Good morning. I'm delighted to be joined this morning by Education Minister Adriana LaGrange for an important announcement, another promise that was made to Albertans in the last election and another promise kept. Today, the Government of Alberta is introducing the Choice in Education Act to strengthen our tremendously successful history as one of the world's leading champions of freedom, diversity, and choice in education. This is legislation that we committed to, and it begins by asserting that school choice and the freedom of parents to direct their kids' education is not a policy preference, it is a fundamental human right. Through this legislation, we amend the preamble of the Education Act to quote Section 23 of the Universal Declaration of Human Rights, that parents have a prior right to choose the education that is best for their children. And that makes the right of school choice and the responsibility of parents to direct their children's education rooted in a fundamental universal right. Unfortunately, there continue to be some in Alberta, special interest groups and political parties who want to undermine this fundamental human right. This legislation won't let them do so in the future. This legislation enshrines the belief of Albertans in freedom, diversity, pluralism, and choice, as well as parental responsibility, because we believe that parents know better than politicians or bureaucrats about what's in the best interests of their kids. I'm delighted that we're bringing forward this legislation for a province that has a long and successful history of high-quality public education available to all Alberta kids. For decades, Alberta students have ranked very high in national and international comparable achievement tests, and that's because the principles of choice and parents' rights are deeply embedded in Alberta's education system. Edmonton Public Schools, for example, came to be recognized around the world in the 1980s and 90s for its particularly outstanding student performance. Under visionary superintendents like Mike Strembitsky, Emery Dosdell, and Angus McBeath, supported by board chairs like George Nicholson, the Edmonton Public School Board pioneered innovations like open borders and school-based budgeting. This fostered competition among schools, resulting in expanded educational program choices for students and parents. To this day, Alberta remains a world leader in school choice, providing more options for our students than anywhere else in Canada and the vast majority of jurisdictions around the world. The diverse mix includes public and separate schools, as well as, of course, alternative schools within those fully publicly funded systems, francophone schools, les écoles francophones, charter schools, independent schools, early childhood education, as well as homeschooling. Over 90% of Alberta's students are in public or separate schools, but they all have access to those other options, and the competition that creates keeps everybody on their toes, generating better outcomes for kids. Because choice means competition, and competition means better outcomes. A top-down, command-and-control monopoly public education that some would like would undermine freedom, choice, pluralism, and diversity, and would result in less competition and worse outcomes. We won't let that happen. The Choice in Education Act will protect and expand student access to the full range of schooling options while strengthening parents' rights as primary decision makers in choosing their kids' education. Specifically, the bill amends the preamble, as I've said, to the Education Act to include recognition of the Universal Declaration of Human Rights, which states that, quotes, parents have a prior right to choose the kind of education that shall be given to their children, unquote. This will be the first law in Canada that explicitly recognizes and enshrines that universal human right. The bill also reduces red tape for the creation of new charter schools, including vocation-focused charter schools, and in this way helps to pave the path to the fulfillment of another platform commitment, which is the creation of the NAIT Collegiate, the Northern Alberta Institute of Technology Collegiate High School, and prospectively a similar vocational high school in Calgary, a proposal that's been out there for many years, and we are paving the way to reinvent the vocational high school because we believe as Albertans that practical and experiential learning, like vocational learning, can prepare young people for fulfilling lifetime careers. It expands their choices, and it recognizes the different skills that young people have. Furthermore, the Choice in Education Act will protect the status and funding of Alberta's independent schools, and it also reduces red tape and provides more flexibility and freedom for parents who choose to homeschool their children. This last point may be especially relevant these days, given that most families have now had to learn a lot more about education at home during the pandemic. To sum up, we are strengthening and protecting parental choice with a high-performance and highly diversified education system. This is a great day for Alberta, and it's a great day for Alberta kids. It's a great reaffirmation of our belief in freedom, in choice, in diversity, pluralism, and high-performance education. With that, I'm happy to introduce Education Minister LaGrange.
Thank you, Premier Kenney, and good morning to everyone. As the Premier said, our province's education system has a long and successful history of offering a number of options for parents to choose the education path that suits the needs of their children. Alberta parents know best. They know what their children need to find success in their education. And Bill 15, the Choice in Education Act, affirms this while recognizing that the breadth of choice and variety of school types available in Alberta is integral to our education system. As a former school board trustee and board chair for Red Deer Catholic Schools, I know firsthand how valuable it is to have different options available to parents to educate their children in the way that they feel most comfortable. We have a strong separate school system, which is a perfect complement to the wonderful public school system in our community. While the majority of parents send their children to either a public or separate school, tens of thousands of parents also choose a francophone school, an independent school, or a charter school. Thousands even choose to keep their children at home for homeschooling. A recent survey conducted by my department showed that Albertans of all socioeconomic backgrounds access all choices in our education system. The important point here is the availability of choice. Albertans have long enjoyed having various options available, which are all strong pillars to our education system in this province. So it is indeed an honor that I will be introducing Bill 15, the Choice in Education Act, into the legislature later today. To support the introduction of this legislation, we are also releasing a report today that summarizes the highlights from the Choice in Education survey. I want to thank the more than 50,000 Albertans who contributed their time to take the survey and shared their views on educational choice. We heard loud and clear that survey respondents value choice and are satisfied with the choices offered in our current system. The results of the survey also showed that there is strong support for the level of choice in our schools, including public and separate schools, francophone schools, charter schools, independent schools, early childhood education, and home education. In fact, 62% of respondents were either very or somewhat satisfied with the current amount of choice in education in Alberta. The expression of support and value for the breadth of educational choice in Alberta contained in this legislation aligns with what we heard from Albertans. It also demonstrates why the Choice in Education Act is necessary. With 62% of respondents being satisfied with the current level of choice, it is essential that government take steps to protect it. Additionally, with almost 40% of respondents stating that they were not satisfied with the current level of choice, it demonstrates that there is still room for improvement. Bill 15 satisfies both of these concerns, enhancing choice for charter schools and home education, while also protecting what we currently have. Throughout this process, we also engaged with and listened to the input from all our education system partners, and we remain committed to working together with our education partners to improve the province's education system for the betterment of all Albertans. As the Premier said, our province's long history and tradition of supporting school choice will continue under this legislation. Our government is proud to be bringing forward Bill 15, the Choice in Education Act, and to be actively working to protect a parent's right to choose the type of education they want for their children. Thank you so much.
Okay, we'll get started with the Q&A. Operator, can you please put through the first caller?
Our first question comes from Chris Barco of the Calgary Herald. Your line is open.
Hello, Chris.
Chris Barco, are you there?
Yeah, I am. This is a question for the Premier. Premier, yesterday the Conference Board put out a report saying Alberta was headed for its deepest recession ever, a 7% reduction in GDP and unemployment to average near 11%. I'm wondering when we're going to see the report from the Economic Recovery Panel, and when is the government going to start spending money on economic stimulus activities, and what should we expect to see?
Well, first of all, Chris, that projection confirms what I've been saying about the depth of the economic crisis that we are experiencing and facing as a province, because we've been hit by the double whammy of the global coronavirus recession. On top of that, the collapse of energy prices to recently their lowest level in history. And I've been trying to prepare Albertans for this. As you recall, in my televised address 6 weeks ago, saying I wasn't going to sugarcoat this, that this would be the most challenging period in Alberta's modern economic history, and it's been made even more challenging by following 5 years of tough economic times. Chris, that is why the government of Alberta has acted with unprecedented ambition to protect livelihoods, families, and job creators from the impact of this double whammy. It's why we've already committed some $13 billion in fiscal action through a range of measures, including the emergency isolation payments, the assuming half the cost of WCB premiums for small businesses, billions of dollars of liquidity being delivered by the Alberta Treasury branches, deferrals on business taxes, on non-residential property taxes, reducing the non-residential property tax, the property tax rate broadly, as well as measures to protect renters and from prospective eviction, and many, many other measures, together with the $1 billion job creation program through accelerated well reclamation that we estimate will create thousands of jobs, the historic investment in the construction of the Keystone XL pipeline that we estimate is creating some 7,400 high-paying jobs in Canada this year. People are already at work on that. It also includes our $1 billion surge in what was already a huge capital infrastructure budget, with a $1 billion addition for maintenance and repair activity this year. That's already underway, creating thousands of jobs. And we'll be announcing more measures in the days and weeks to come. The Economic Recovery Council will not be issuing a report. That was never part of the mandate, but rather I meet with the council periodically we started out once a week, we're now once every other week, to get their input on what measures we should take. And so they've provided very useful guidance on that. And of course, all of this is in addition to work that the Government of Canada is doing, which includes the recently announced liquidity measures for both mid-cap and large-sized energy companies and other distressed industries, including tourism and aviation. We acknowledge that a lot more needs to be done and will be done. In June, Finance Minister Travis Toews will be presenting to Albertans in the legislature our economic recovery plan, which will be bold and ambitious and will focus on putting the pedal to the metal in terms of diversification in key growth industries in Alberta, as well as creating the best overall economic conditions to bring job-creating investment back to our province, and ensuring a future for our largest industry, which also happens to be Canada's largest sector, the energy industry. So I'll say we've taken, and by the way, on a per capita basis, the fiscal actions taken by Alberta's government to deal with the economic crisis is, I understand, greater than the fiscal commitment made so far by any other provincial government. This, of course, includes the extraordinary emergency investments that we made in healthcare to address COVID, both the hospitals as well as mental health. So we've already taken greater action than I believe any other province, and we'll be taking more action in the days to come. But as I've said, Chris, the government does not have the fiscal power to protect every single business or household from what is coming at us, which because of the depressed energy prices and the scale of global oil inventories likely means a low price environment for upwards of 18 months. So we have to keep some of our powder dry. We have to not take all of our actions right now in the immediate term. We need to plan this out thoughtfully. In our economic response, we need to plan it out thoughtfully for the midterm, but also plan for the long term.
Operator, can you please put through the next caller?
Our next question comes from Tom Vernon of Global News. Your line is open.
Hi, Premier. Thanks for taking my question. It's on a different topic as well. You're speaking with the Prime Minister. Are we going to be asking for any supports for long-term care, or what kind of supports do you think the federal government should provide to help our long-term care seniors facilities?
Well, we already have received some support through the federal funding in partnership with the province for people who are in essential. Let me rephrase that, Tom. Sorry, it's a wage top-up program for essential workers who have low levels of pay. So we've been able to bring forward the $2 wage top-up for healthcare aides in long-term care facilities, and that's part of our broader $172 million package that was for protecting seniors in long-term care from COVID. That was detailed by Health Minister Chandra last week. And I understand the federal government is looking at potentially additional measures to help provinces protect and support seniors who are uniquely vulnerable to this pandemic. We'll be having a call with the Prime Minister and all the premiers later today. I understand that that is on the agenda. And we will obviously partner with the Government of Canada if they come forward with any additional support in that regard. I have to say that with the exception, we have had obviously some outbreaks in long-term care facilities in Alberta. There were two that were particularly tragic that we know about, of course, including Mackenzie Town. I'm glad, however, that Alberta has not experienced the same kind of scale of tragedy that we've seen in some other Canadian provinces and some U.S. states. But that is by no means should we rest on our laurels. As I said yesterday in my speech to the legislature, as we go forward, our pandemic response has to be increasingly targeted and focused on protecting the most vulnerable. And at the top of that list are seniors in continuing care and other congregate living facilities. So I believe we've had a strong response to that with limitations on visitors, with this offering protective personal protective equipment, to long-term care and other similar facilities, to making testing available, to including testing asymptomatic individuals in those centers, to requiring that staff must only work at one long-term care facility so they cannot potentially bring the virus into multiple residences, as well as the wage top-up and a number of other supports that, as I say, were announced by Minister Chandra last week. So I think the Alberta response has been very strong, and I just hope that we all understand that the real focus in the future has got to be a ring of defense around seniors' residences, continuing care, and again, we'd be happy to collaborate with any additional federal measures in that way.
Operator, can you please put through the next caller?
Our next question comes from Jason Herring of the Calgary Herald. Your line is open.
Hi there, Premier. A third question off topic, unfortunately, but on the topic of Edmonton possibly becoming an NHL hub city, I'm wondering if you could clarify what exactly you're looking for from the federal government in facilitating getting the postseason to Edmonton. Is it exemptions or relaxations for rules surrounding travel and quarantine? As well, I wanted to better understand what the economic impact of hosting the NHL in Edmonton would be, given that no fans would actually be attending games and the teams and the players would theoretically be in a bubble completely separated from the rest of the city. How exactly is this going to have a significant impact on Alberta's economic launch?
Sure. Well, on the second question, if Edmonton were to win the bid, you would have hundreds of folks staying in downtown Edmonton hotels, creating hundreds of service industry jobs, including for hotels that have had to shut down and lay off hundreds of staff. So right there's a significant cash injection. There would obviously be broadcasters coming in, support staff. We believe all of those folks could be safely accommodated in a quarantine zone and without posing any kind of risk to public health. And we're pleased that Chief Medical Officer Dr. Hinshaw has endorsed the proposal in principle and has demonstrated a willingness to work with the Oilers and the NHL on ensuring a quarantine cohort approach to the prospective playoffs here in Edmonton. So again, you'd be creating, this would not have a massive effect on the Alberta economy, but you'd be getting probably over the course of a couple of months, tens of millions of dollars back into the service sector here in Edmonton, and that is desperately needed. Secondly, I was just talking about the long-term economic recovery that we're focused on, and that's going to be especially important in the tourism industry. And I can't imagine a better way of getting free advertising for Alberta than having tens of millions of eyeballs from across the world watching NHL playoffs in Edmonton over the course of several weeks. It would be the biggest free marketing that Edmonton has had in a long time, and that Alberta perhaps has had since the Calgary Olympics. So I think it would be a great branding opportunity for the future relaunch of our tourism industry. It would also I think, help to show the world that how well Albertans have done in combating COVID. The fact that Edmonton has the best COVID record of any NHL city, I think, would come to light, and people would be asking, what has Alberta done? I think that would also bode well for future investment, travel, and tourism. So those are, I think, compelling reasons why that explain partly why we're behind the bid. In terms of what we're asking of the federal government, it was very specific in the letter I sent to Prime Minister Trudeau a couple of days ago. We are asking for the Government of Canada to take the same kind of constructive approach as the United States government, essentially to work with us in interpreting the 14-day self-isolation requirement for international travelers as being able to apply in a quarantine cohort, to quote Dr. Hinshaw. That is to say that the players and support staff wouldn't have to be individually in a room, but that if we create a quarantine zone, which is very I think easy to do in the Edmonton Ice District, that would qualify for the federal self-isolation rules. And so that's the request that the U.S. has a 14-day self-isolation requirement for international travelers. They've said in this instance they're prepared to adopt a group approach within effective quarantine zones, and I think we can safely do that here. I think Edmonton is uniquely well designed for that, because I don't know, it's the only NHL city I know of where you have two NHL-sized ice surfaces attached to two hotels in what can be a completely sealed zone, and it just seems purpose-built for that function.
Operator, can you please put through the next caller?
Next question comes from Lisa Johnson of Post Media. Your line is open.
Good morning. Thanks for taking my question. This is for the minister. I'm wondering if, with this bill, how many applications for charter schools you foresee being created, and what would the effect of that be? I mean, will funding for school boards go down if homeschooling and charter students are no longer under the umbrella of school boards?
So thank you for the questions. The number of charter schools, I can't anticipate how many charter schools may be interested in, or individuals may be interested in looking at a charter school. To date, since I've taken office, we've had no applications for charter schools. But that being said, this does allow them for even a newer, enhanced opportunity to look at a vocational charter school. In terms of the dollars, we fund charter schools to 100% funding, similar to our public schools, and I don't see a change because those dollars follow the student, and so again, we haven't had a request thus far, and we'll look forward to seeing what comes to us in the future.
They pay their own capital costs, right?
No, that's independent.
Okay. So I just wanted to supplement that by saying the school choice in Alberta saves the taxpayers a lot of money. And in fact, a study done last year estimates that our school choice approach has saved the taxpayer about $1.8 billion over the past 8 years, and around $250 million a year, because the cost of supporting a child in independent schools and homeschooling are substantially lower than in the fully funded public schools, and charters do operate more efficiently on a per pupil basis. So we see this as actually school choices as creating a much more efficient system rather than forcing a competition for resources.
Operator, can you please put through the next caller?
Our next question comes from Janet French of CBC. Your line is open.
Janet, are you there?
I both know. Oh, can you hear me?
Yes.
Yes, we can.
Okay. All right. Sorry about that. Thanks for taking my question. This is for the Premier. So you and I both know that COVID is caused by a coronavirus. Yesterday in your legislature address, you referred to it in multiple occasions as an influenza. In your address, you also compared the mortality rates of COVID to some other conditions. But some of the early evidence suggests that people can have longer-term health complications as a result of an infection from COVID. So first of all, I'm curious, why are you using the word influenza to talk about this virus? And second of all, how much of a factor in your decisions about reopening the economy and easing health restrictions are the potential long-term health effects on people from having had COVID?
Well, yeah, of course it's the coronavirus, a novel coronavirus. And I have to go back and check my remarks, but I believe I was referring to other kinds of pandemics, like influenza pandemics, where we've seen them abate in the summer, come back in the fall. And obviously, epidemiologists in assessing the threat posed by the COVID-19 look at experiences that we've had in the past. Our Public Health Act refers specifically to an influenza pandemic that is part of the statutory basis for the declaration of a public health emergency. So, of course, this is a novel coronavirus. The experience that we've had in the past dealing with pandemics of this nature have typically been around influenzas. And so I guess say that in some respects the two are analogous. In terms of you're absolutely right that this can have a devastating impact on the health of people at all age cohorts, and it can apparently have long-term negative physiological health effects. Yesterday, I was not trying to provide a comprehensive scientific exposition of the nature of this disease, but rather to say that Alberta has, I think, performed very well compared to most other jurisdictions, while taking a less stringent approach to public health regulations. And I was indicating how proud Albertans should be of their response, which has largely been through their own choices, personal responsibility, and regard for others. And that's my point, which is that Alberta has had I believe, the least stringent public health orders, at least of the large population Canadian provinces, and yet we've had some of the best outcomes in terms of the per capita rates of hospital admissions, ICU admissions, fatalities, and so we should be proud of how we performed as a province, as a people. So I'm not in any way seeking to diminish the threat that this poses. This is one of the reasons we continue to have very strong public health measures in place. It's why we continue to ask Albertans to exercise that personal responsibility. Follow the advice of our Chief Medical Officer. Wash your hands frequently. Try to maintain that physical distancing where possible. Try to use a face covering if you can't maintain physical distancing. Stay home if you're sick. Stay home if you've arrived from travel abroad, and follow all of the other rules. And that's how we'll get through this together. At the heart of my remark was the notion that in the future we need to be very focused on protecting the most vulnerable, and it's very clear that tends to be the elderly and people with certain health conditions, particularly those who are immunocompromised or have respiratory conditions. And I think that's the key learning right across the world. We see in jurisdictions like Quebec, where there have been much higher number of COVID-19 related deaths. They have been overwhelmingly in coming out of infections in seniors' congregate living facilities. And that's true in Alberta, where I believe some 75% of the deaths in this province have been amongst residents of those continuing care facilities. And so that's why I believe that increasingly our policy approach must be a very strong ring of defense around those kinds of facilities, around the most vulnerable, and that we should also, in the future, if and when we see a second wave, we should also be particularly mindful of the broader health, social, and economic impacts of suspending entire sectors of economic or social activity. The government of Alberta is tracking non-COVID related health data to see, because I think there have been reports from doctors and authorities in other jurisdictions about increases in mental health and suicides. Thankfully, we have not yet seen that demonstrated in the data in Alberta, but it obviously is a concern when coupled with the economic crisis through which we are going. And that is why the government of Alberta has added $53 million through a COVID-19 related mental health response. So my point there is that we have to be mindful that for every public health measure that we take which impairs social or economic activity, there are other downstream effects. When we set aside thousands of hospital beds for COVID patients to avoid being overwhelmed in the healthcare system, there are negative effects in terms of people waiting longer for care and surgery. So I was taking a step back to say we have to be mindful of all of those broader health, social, and economic consequences as we move forward, increasingly with a defensive approach for the most vulnerable.
Operator, can you please put through the next caller?
The next question comes from Eva Ferguson of the Calgary Herald. Your line is open.
Yes, I had a question specifically about repeated use of the word choice in this new legislation, and how the Premier specifically responds to criticism that paving the way for more charter schools provides increased access and choice, when we know that many charter schools operate much like private schools with lengthy waiting lists, hidden fees, entrance requirements, application processes. So for many students, most average students with families that have average incomes, this is not a choice. These schools are not a choice to them. So why would you include them as types of schools that would increase choice in education?
Well, I completely reject your preamble. obviously, different kinds of, different forms of schooling that are available to parents and which are publicly funded offer more choice. And you're absolutely right. The waiting list for charter schools is unacceptably long. Last I heard, there were 14,000 students province-wide waiting for a position in a charter school. As you know, since the creation of the charter schools in Alberta, I think in roughly 1995, there's been a statutory requirement that they take kids from all backgrounds. That it's not like independent schools. There's not a screening out process. They are inclusive schools. There are children from all different social and economic backgrounds who attend charter schools, which have great outcomes, and so that's exactly why we hope to see a growing number of charter schools to respond to the demand that exists in the public system. In my remarks, I referred to the important reforms that occurred in the Edmonton Public School District back in the 1990s with the creation of, for example, the alternative school programs. Those were, you can talk to the folks who were on the board or in the administration at that time, and they will report that it was precisely Alberta's approach to school choice, including independent and charter schools, that forced the Edmonton district at the time to up its game and to offer more specialized programs, to offer more choice within the conventional public schools. So I believe that streamlining the red tape to make it easier for parents to propose and create new charter schools, specifically allowing for the creation of vocational charter schools to, for example, pave the way for something like a NAIT collegiate in the future, will help to reduce that waiting list for kids to get into the charter school. So that list is an indication of the desire of parents to for their kids to get into charter programs, and this is a policy response to that desire to expand, hopefully in the future. And by the way, I should mention that the legislation introduced today is on top of changes that were made to the Education Act last year by the current government, which lifted the cap on the number of charter schools. So we've already facilitated the creation of more charter schools. This legislation takes another step forward, and we hope that local community groups will respond positively by expanding access to these choices.
Okay, we have time for two more. Operator, can you please put through the next caller?
The next question comes from Mota of City News. Your line is open.
Thank you. Premier, yesterday in the House, you referenced that we cannot continue to impair the social and economic, as well as the mental health and physiological health of the broader population for a potential year for an influenza that does not generally threaten life apart from the most elderly, the immune compromised, and those and others. So I'm just wondering, how do you respond to people who are saying it seems that you're minimizing the elderly and those kind of more high-risk groups when you say that?
I respond by saying I'm doing exactly the opposite. I'm saying that we must focus our efforts in a real way on defending the most vulnerable, and that is particularly the elderly and those with certain health conditions who are uniquely vulnerable. The reality is that across the world, the overwhelming majority of those who have been hospitalized and died because of COVID-19 are seniors, and as I've said, the average the average age of those who have passed away because of this coronavirus in Alberta is higher than the average life expectancy in our province, and so those are the folks we must focus on most to protect. And here's my point. I know that in the fall, when we come back to reopen the schools, there are going to be some voices saying that in the absence of a vaccine or some widespread medical treatment for COVID-19, that we're somehow jeopardizing the health of kids. And what I'm trying to do in part is to reassure people that, yes, it's true that we have seen the COVID-19 has affected the health of some young people, but a tiny number and relative to, for example, other kinds of health threats that younger people face. And so my point is that we can do things like reopen the schools with appropriate public health guidelines, with appropriate sanitation, with trying to do things like spacing. We all need to continue to follow those general health guidelines, but what we must focus on is protecting the most vulnerable. And that is why Alberta's government announced our $172 million package to support continuing care and other congregate seniors facilities to protect them from the pandemic. And that's where the focus must and should be in particular in the future. So my point is simply this. There are there are extremes in this whole debate in the context of the pandemic. There are some people on one side who say that the whole thing is overblown and we should have basically no public health restrictions and just go back to normal for everybody. I think that would be grossly irresponsible. On the other side, there are some people who say that we should essentially suspend virtually all of our economy indefinitely, and I think that would be irresponsible as well. What I'm reflecting on is the challenging policy decisions that we must make upon the advice of our public health experts every day about how to balance things, how to protect the vulnerable, but be mindful that every public health order that suspends an area of economic or social activity also has negative consequences. And we are going through an economic crisis in the province. The lost livelihoods and life savings and businesses, dreams, jobs, the financial stress, that can be manifest in mental health challenges, in addictions, in domestic violence, in broader social problems. We must be mindful of that as we go forward in the future. So I believe we should be increasingly focused on that wall of defense around seniors and other measures where we are leading as a province, maintaining high levels of testing, to have a very robust system of tracing, tracking, and containment to deal with any future outbreaks. We have to have enhanced border screening measures, which Alberta is leading on with the strictest border screening measures in Canada. We have to, I believe, encourage people to use face coverings in crowded areas where they can't physically distance. We should help our public health officials by using technology like the tracing app that is voluntarily available for Albertans. All of these are ways that people can help to limit the spread. The bottom line is this. When we introduced these extraordinary measures starting in March, the immediate goal was to flatten the curve to avoid our healthcare system from being overwhelmed. And we have succeeded in that respect with flying colors. Today we have about 45 people hospitalized with COVID-19, with 1,000 COVID-19 acute care beds that have been set aside. So we have 4% utilization. At the peak, we had about 2,500 COVID-19 beds set aside, and I think around 100 people who were hospitalized. So Albertans have done very well in flattening the curve, protecting the healthcare system, and now as we move forward, I believe our focus must increasingly be on protecting the most vulnerable from the coronavirus. All right, thank you very much, folks. That was the last question, right? All right.